These are the classes that you have to take. And then there are also some schools that require additional classes on top of that, but not every school has that requirement. But you want to show that you're not just fact memorization, just book smart, that you have emotional intelligence as well. You want to be able to talk to your patients and level with them. Just talk to them as a person, not just a disease that you're treating. Hi friends, how are you today? Welcome back to my channel. I know it's been a few weeks since I posted a video. I do apologize guys, dental school has been a little bit crazy, but since I just finished block 2 and I have a few days off, I thought I could record some content for you guys because I missed recording and I'm gonna get back to vlogging now, and I just wanted to make some more informational videos for my admission series because I think that this is kind of the point in the year where people start to really think about that for the following cycle. So that would be the 2022-2023 cycle. And if you're new here, hi, my name is Madina. I make videos for pre-dental students and I vlog my journey through dental school. So I would love it if you could like this video, subscribe down below, and ring the bell so that you're notified when I upload. I know sometimes it's a little bit spotty, but I try to upload either on Mondays or Thursdays once a week. So thanks for joining us and I hope you stick around. So today I want to talk to you guys about the classes that you have to take in undergrad in order to go to dental school. And these are going to be your prerequisites that pretty much any dental school is going to require, and then mention some other classes that only certain schools require but are also a good idea to have. So first I want to talk to you guys about just general prerequisites that you're going to have for any dental school that you apply to within the US. These are the classes that you have to take. And then there are also some schools that require additional classes on top of that, but not every school has that requirement. So the first thing that you're going to have is you will need to take a year of general chemistry, and then you will also need to take a year of general biology, which is 2 semesters with lab. General chemistry is also 2 semesters with lab. Then you will also need to take a year of organic chemistry, which is also 2 semesters with lab. And then you will also need to take physics, again, 2 semesters with lab. Now, something that a lot of people don't know is that part of your prerequisites are actually math classes. I know, you're going to dental school, right? Why do we need math? I asked myself the same question when I was sitting there in calc and wondering how I was gonna, make it through this class, because personally I'm not necessarily a math person. So the other requirement in order to go to dental school is Calculus 1 and then either Calculus 2 or statistics. It's up to each individual person. I wasn't very good at calculus, so I decided to take statistics because for me it was just more straightforward and I was able to do better in that class than I would have done in Calculus 2, which is just math that I can't even think of right now. But yeah, so those are the basics, right? So you've got a year of Gen Chem, a year of Bio, a year of Orgo, a year of Physics. All of those have to be with labs. That means that obviously you're going to have to put in a lot more semester hours than for just a regular elective science class, because you're going to have to be there for lecture hours. Some colleges, like my college, also had recitation for that lecture. And then you're also going to have to put in the lab hours, which means you're going to be doing lab reports. And so throughout your 4 years of undergrad, or before you apply to dental school, if you're applying to go straight through without a gap year, you're going to have to apply in your junior year of undergrad. Technically, you just have to take these courses before you graduate. But there are also certain dental schools that want to see that you finished all of your prerequisites before you apply. So if you're the type of person who doesn't want to take a gap year after undergrad, you have to really think about having to squeeze in and double up on these courses in order to have everything finished by the end of your junior year. Because there aren't that many schools that do this, but I do know that some schools in the area where I applied do require you to have finished at least all of your science prerequisites before you apply to their school, because they want to see your grades from those courses and they want to know that you can handle them and do well academically, which is understandable. And for me, it wasn't that much of a stress because I was applying at the end of my undergrad career. I was taking a gap year, so I didn't mind because I would have had to take those classes by the end of undergrad anyway. But it did allow me to space things out a little bit more because my freshman year, our school had sort of a pre-health track, and so we had to double up. So we started with general chemistry, and then our lab for both semesters was for some reason combined into the second semester. So second semester I was taking general chemistry and Bio 1, and then the following semester I started taking Bio 2 and organic chemistry 1, and then the following semester I took organic chemistry 2. So at that point, which was the end of my sophomore year, a lot of people decided to continue doubling up and took Orgo 2 with physics. I personally had a terrible experience doubling up with science classes, especially because our school was not very considerate and they would put the finals on the same day for both of those classes, probably like 30 minutes apart. That happened twice. So I decided not to double up anymore, so I just ended up taking organic chemistry 2. And then the following year, I actually ended up taking biochemistry. And biochemistry is another one of those requirements that pretty much every single school requires. But the good news is that biochemistry is now considered an upper level elective. So my school personally, and I know that other schools offer biochem as either through the chemistry department or through the biology department. So the option that was through the biology department actually had a lab component, and it was 2 semesters long, whereas through the chemistry department did not. And so for dental school, you just need to take the biochemistry lecture course. You do not need the biochemistry lab. I know that a lot of people don't necessarily know this. They know they have to take biochem and they assume that you have to take the lab with it. That is not the case. You do not have to take the biochem lab. You just have to take the biochem lecture. But those are the basics, right? So chem, bio, orgophysics, and then you need either 2 semesters of calculus, calculus 1 and 2, or you need calculus 1 and statistics. Now I do know that for some people there is such a thing as psych statistics, which is essentially very similar to a traditional statistics course, but psych stats is more focused toward case studies and how you would apply statistics to data that you would get clinically. And I know that some people have had success getting it as a course equivalent and an exemption, so that when they apply, they would have their psych statistics class apply as their second math requirement. And then remember the biochem, again, no lab required. I want to stress that because I personally didn't know that, so I was really stressing out about having to take a biochem lab when I didn't need to. So now I'll get into some of the extras and bonuses that are nice to have and that are going to be helpful to you, especially in your first year of dental school, but are definitely not required, except for maybe certain schools do require. It is obviously anatomy and physiology. And you guys can guess as to why that would be an important course. It is the basis of your first year education, regardless of the school that you're at. Even if it's medical or dental school. Currently at Columbia, we are integrated with medical students, so we're technically in medical school for the first year. So our first year education is very, very heavily anatomy based. And so I've noticed that I personally have not taken an anatomy course in undergrad, so I tended to struggle a lot in the beginning of the semester in terms of getting adjusted to everything, getting down the terminology, trying to remember different mnemonics. And so a lot of people who had taken an undergrad anatomy class, which is usually less comprehensive than what you would do in dental school, they definitely had a leg up because for them it was more of a refresher. For me, it was something that I was learning for the very, very first time. And so definitely I would say, even if you're looking at schools and anatomy is not required, I would say absolutely think about taking it if you have time during your undergrad career. That is one of the classes that I really, really regretted not being able to take, and that a lot of first year students and other dental students that I had talked to before I started dental school did recommend. Now, the other classes that I would say absolutely you want to make sure that you look into taking are classes like cell biology or histology. So if your school offers one or both, I would say it's a good idea to take one, just because again, you are going to be looking at cells and tissues under the microscope. You're going to be looking at the pathology of those cells and tissues, because you want to be able to explore the possibility that if you're going into a medical career, there is the field of pathology, and for you to understand what the tissues look like and being able to diagnose certain diseases and disorders based on that. And so again, histology was a main component of our blocks 1 and 2. And so if I had the time, I really would have considered taking either cell bio or histology. My undergrads didn't really offer histology, so my option was cell bio, but for that class, it was 2 semesters and it was a lab, and there was just no way that I could fit it into my schedule without really overloading myself certain semesters. I'll actually include an idea list of required or recommended courses from dental schools, because what I'm talking about is not exhaustive, it is not comprehensive by any means. I want you guys to have all the information, so I will link it in the description box below for you guys to check out. But obviously, if you're very, very interested in a school, don't take just one source, go directly to the school's admissions page. They will usually have the listed out requirements for you, whether that's required or recommended from that school in particular. And so it's always a good idea, if you're super passionate about going to a school, you take all of these courses and make sure that you are aware of what they require, so that you're not stuck sitting there at the beginning of the admission cycle and saying, I want to apply to the school, but I don't have this prerequisite, which means that they will not review my application. So in terms of that, another lesser known class that a lot of schools do actually require is microbiology. And I actually had no idea that a couple of the schools that I wanted to apply to had required microbiology. So although I had the grades and although I was kind of applying to the same tier schools, I ended up not applying to one or two schools on my list because I did not have the microbiology requirement. The other thing that I want to mention, guys, is that you don't ever want to neglect your humanities. So the trend has been in medicine that back in the day, they used to really take people who were very good at the sciences, super intelligent people, but the problem that arose from that was that you were left with doctors that were not able to effectively communicate with patients, that didn't necessarily think about psychology and sociology in terms of patient care and discussing issues with their patients, and so it led to a little bit of bad blood between the patients and their doctors. So nowadays, they really are looking for people who are very well-rounded, that you're not just taking science courses, you have some humanities courses in your docket. So I would say a good idea to take a look at. Most undergrad institutions require psychology or sociology anyway as sort of like your core prerequisites that you need to graduate. I know my school did, so it's a good idea to look into that. A really cool course that my school offered was medical sociology, where we discussed certain issues in medicine and how doctors and patients have dealt with that, certain big cases of doctor-patient miscommunication. We read some really interesting books and articles about that, so that was a really interesting one. Another class that I was fortunate enough to take was narrative medicine, where we read pieces of literature, whether that was short stories, books, poems, from the perspective of patients that were receiving either long-term care or care for acute conditions. And so it kind of just gives us a different perspective as to not just the disease and how to treat the disease, but also the person that is behind the disease, right? The person who you are actually treating. So it's a good idea to not neglect your humanities. Take an English course, take a literature course. If you have the opportunity to take something like narrative medicine, like medical sociology, and you want to tie it back to your medical education, that is absolutely fine, but you want to show that you're not just, fact memorization and you're not just book smart, that you have emotional intelligence as well. That's another big thing that you want to have in your undergrad transcript. So if you're ever wondering, you need another class to add to a certain semester because it's looking a little light, you want to look into classes like that, because generally they don't tend to be as intense or as memorization heavy than, say, your science courses. Even though it was a lot of reading for certain classes, it kind of gave my brain a nice little break. I didn't have to think about the Krebs cycle or kinematics equations. I could just think about patient care and how a patient would feel about our doctor if they talked to them a certain way versus another way. It made me feel even closer to the field of medicine than my science courses did, because it was actually discussing patient care. Usually it was from the perspective of patients as opposed to just the doctors who were treating the patients with the disease. So I would say that that's another really good recommendation. Don't skip out on that. That is one of the main things that I think that pre-health students in general, that's what a lot of people kind of neglect, because they think that it's something that is not really necessary because you're going to medical school, you need to be good at science, and that is absolutely true. But again, you want to be able to effectively communicate. You want to be able to talk to your patients and level with them. Just talk to them as a person, not just a disease that you're treating. Okay, so that's my spiel for today. I hope you guys enjoyed this video. Thank you so much for continuing to watch. Thank you guys for subscribing. Thank you for leaving comments. If you have any other questions about any classes that you are concerned about or worried about, or wondering what you should be taking at which point in your undergrad career, feel free to drop me a comment down below. I'm very responsive with comments. I'm always happy to help you guys and give you advice. So thank you guys again for watching. Don't forget to like this video and subscribe if you're not already, and I will see you guys in my next one. Bye.